Hello, we are here with Dr. Consuelo, and we're going to interview her about drug abuse and the effects on the neurological system. And the first question is, what causes this disease?
Well, the main cause of this disease is being exposed to a drug that causes addiction, and this may alter the genetical expression of causing the addiction to the drug that you were exposed to, and that's how drug addiction begins.
And how serious is it, and how does it affect a patient's life?
It is very serious, Monse. Once you develop an addiction to a certain drug, then you become dependent on it, and as time passes and the amount of drug that you are exposed to, the symptoms begin to increase, and the symptoms can be throughout your whole body.
Okay, thank you. What are the short-term and long-term prognoses for this disease?
Well, short term, what the main effects that this disease causes can be euphoria. You can become extremely having mood changes. Your heart rate beats faster. You start having a lot of swing moods. You get hypertension, which causes risks of getting a stroke or having a cardiac arrest. You can have effects short term on your respiratory system. On the long term, the prognosis is that you start having brain damage, and that brain damage increases as the ongoing exposure to the drug is prolonged. You can also have liver damage. You can have kidney damage. And depending on the amount and the time, can tell you if it's reversible or not. Although usually if it's the neurological effects are usually not reversible.
And what is the chief complaint that patients have for consulting?
Well, mainly it's because you lose control over your life. And either you come because you finish out in the hospital because of what I've told you. Either you had a stroke or a cardiac arrest, or you develop asthma or HIV because of the needles you're using, hepatitis. It's either a health issue that makes you come to the doctor to have a consult, or sometimes it's the family members, because this disease affects all the family system where you live at, either if it's your parents or it's your spouse, your children. It can be both ways.
What kind of symptoms can the patient present?
The symptoms depend on, well, all the body systems that I mentioned. You can either have convulsions, epilepsy. You can have a stroke. You can have cardiac arrest. You can have mood swings. As for neurological symptoms, you can have depression, anxiety, attention deficit disorders.
And how can a patient be tested for this disease, and what do the results show?
Well, usually you'll get a blood sample if you suspect that a patient is using drugs. You'll get a blood sample and run a test to see which drugs is in his system, and depending on that, you will prescribe a treatment.
What are the treatment options?
Well, usually if it's something that has become chronic, you will indicate a rehabilitation clinic, and the rehabilitation clinics have specific programs to help you detox from that drug.
How effective are these treatment methods?
Well, it depends on the drug. It's not the same if you are addicted to, let's say, nicotine, which is a socially accepted drug, rather than if you're saying you're addicted to cocaine. It's different.
What would happen if the patient doesn't get treated?
Well, for sure, it could end up with the death of the person, or with very severe complications and side effects from the drug use.
Are there any new treatments and new technological devices for preventing, diagnosing, or treating the disease?
Well, mainly what right now the medical community is aiming towards is education, giving enough tools, educational tools, to adolescents, which is when usually it begins, to parents, to school teachers, and mainly education the public, education to the public, so that you can know what you are exposed to, what the risks are, and try and prevent. That's the main tools that we're using right now, prevention.
Well, thank you very much, Dr. Consuelo. This is all for today. Your information will be very helpful to us.
Well, I'm glad I can help.
Thank you.